February is the time of year for heart health awareness, and all month long we've been educating you on the importance of heart health. We've stressed diet, we've stressed exercise, and this morning we're talking about how COVID is affecting the heart and why regular heart screenings are so important. Joining us this morning is Dr. Sanjay Verma, a cardiologist at JFK Memorial Hospital. Good morning to you.
Good morning, and thank you for having me here.
You're so welcome. Let's start with what you've seen lately. I mean, there's a lot of talk about COVID affecting the lungs, but what about the heart?
So the way that COVID affects the heart is a couple ways that are very important to talk about during this month. So first, I want to emphasize the importance of what we're not seeing, where some patients are a little afraid to come to their doctor or clinic or the hospital to get evaluated for their pre-existing heart conditions. And it's really important to understand that we have very strong infection control measures, and having their heart conditions maintained and controlled is important to also reduce COVID complications. In terms of what we're seeing with COVID's impact on the heart, it can be anything from dizziness, lightheadedness, palpitations, or racing heart, chest pressure, difficulty breathing, decreased exercise capacity, or fatigue, all of which are ways in which COVID impacts the cardiovascular system.
Wow. And is this something that is a lasting effect? Say you're diagnosed with COVID. Is this something that you have to be concerned with even after?
And that's a very important question in terms of the long-lasting effects of COVID, how these symptoms might persist. It's important to remember that COVID's been around for about 14 months. The knowledge and expertise in this is rapidly evolving every week and every month. And one of the emerging areas of interest is, in fact, what's known as long-haul COVID or long-term impact. The exact number of people who might be affected by this is still unknown, but there are estimates that it's quite considerable. And yes, some people can have long-term symptoms of shortness of breath and fatigue, decreased exercise capacity, even beyond 6 months after exposure to COVID.
Still, obviously, more research to be done there. As far as taking care of your heart, we keep stressing through the month of February, all we've been talking about is diet and exercise. But then just yesterday, we did a story on a woman who genetically was predisposed to heart issues in her family. How much, doctor, is a person really responsible for their heart health?
The degree to which a person is responsible for heart health is an ongoing process of understanding. Genetics is probably one of the strongest impacts with family history in heart disease, as well as risk of severe COVID complications. And it's important to understand that we can't change the past in terms of the genetics or family history we were born with, but we can certainly modify the degree to which those genetics and inborn family history dynamics allow the heart disease to remain uncontrolled. So as you mentioned, diet is very important with decreasing carbohydrates, processed foods, fried foods. Exercise is a very strong contributor to immunity and inflammation in the body, as well as cardiovascular risk factors. And a person can impact their heart health more than most people realize.
Okay, good to know. Is there anything we're missing? I know stress is mentioned a lot, people to try and reduce it. What are your tips or suggestions on that?
That's a very important aspect also to keep in mind with respect to mental, psychological, and physical stress. And so sleep quality and duration are very important aspects to evaluate and consider, especially undiagnosed sleep apnea can increase the body's adrenaline and inflammation, impacting heart health and stress, and a person's ability to respond to stress. Diet and exercise also contribute to one's ability to managing stress better. And in our current environment with COVID, it's also important to reach out to each other within the safety limits of distancing and masking, because mental health is a growing challenge during the COVID pandemic.
Great points there. Thank you so much for joining us this morning, Dr. Sanjay Verma. We appreciate you taking the time to speak with us on this really important matter.
Thank you for having me.
And we'll be right back.